The pelvic wand can be used to do external fascial release and muscular release for treatment of tailbone pain. And this can be useful as a warm-up before doing internal treatment or as treatment on days where you're simply not feeling like doing internal treatment. Start with using the blunt end here and gently bringing it along the sacrum. I recommend doing this in side lying. So here's your pelvic floor and here's your spine going this way. The long thin end can be used to brush against the long flat end of the sacrum just to warm up the tissue that's above the tailbone. And then from there, this angle can be used again to come into the hip. So just coming from the midline, about where you feel your gluteal muscles start to separate, and gently pulling out to the side like this. And then you can roll over and do the same thing on the other side. And then additionally, pelvic floor dysfunction. You can also use the flat end to be coming off of the perineum like this, laterally in the laying down position, and then back and around the tailbone here. And then again, you can slowly introduce the tip at the anus. I recommend inhaling and relaxing and dropping, and then exhaling. And then on the next inhale, bear down as if you were going to pass gas, and slowly introduce just the top fourth of the pelvic wand. Take a beat. Your pelvic floor muscles may spasm because it's not used to having something come in. Relax and bear down again and introduce a little bit more of the wand and incrementally move for internal work. But starting with an external release can be really, really helpful to prime the tissue and the body. And keeping in mind, when we're treating the tailbone, we want to address everything above, to the sides, and below.